Hello, everyone, and welcome back to Rarely Typical, a podcast where I am talking about what life looks like with a chronic illness, especially a rare one. And I do feel like those are very different, but they can be very similar. Today, I'm going to be talking a little bit about what the rareness affects in my life and how that changes things with my medical care. So, I feel like something that doesn't get talked about enough is being chronically ill means being chronically inconvenienced forever. And if you follow me on Instagram, you know that I already posted about this, but I felt like I had to give you long form content and context as to why I made that reel. So if you don't follow me on Instagram, I made a reel about being chronically inconvenienced and not realizing when I was diagnosed in 2018 that when I was diagnosed, not only would I be chronically ill for the rest of my life, but I would also be chronically inconvenienced for the rest of my life, like forever. For the rest of my life, I did not see it coming that it would be so monumentally life-changing. Like, I knew that my life was going to change, but I don't think I realized how much the day-to-day would change, and that has been the season that I am living in. So when I was diagnosed in 2018, I did understand the Google version of what I was facing. If you are diagnosed with a rare disease, or if you're diagnosed with chronic illness in general, when you're in the hospital, like the very first thing you do is that you start Googling. And so, yes, I did understand the gist of what life was going to look like because of the content creators that I found, which there weren't that many back in the day. And I also understood that there were going to be medications that came into play, treatment plans that came into play. I knew that I was going to be going to the doctor more often than my not going to the doctor at all life. And I knew that pulmonary arterial hypertension was going to mean that my life going forward was not going to be the same. I wasn't naive. I just don't think that when you are diagnosed with a rare disease or a chronic illness that you realize what the actual weight of that is going to be. Like, I think I knew that it was serious, but I don't think I realized like how it was going to look day to day and how the inconvenience of being day to day in a body like mine would become the fabric of everything that existed for me. It doesn't go away. It changes shape every week. And I think that the more that it morphs, I am surprised, even though I feel like I shouldn't be surprised. And I think that the shape of it has been changing so much recently, especially with the season that we're in. It has just been monumentous. So if you didn't know, I'm married. I have been married to my husband for 11 years now, which is crazy. We have twin boys who are 8. A question that I get a lot is, was I pregnant after diagnosis? No, I actually was diagnosed after pregnancy. And that's a question because if you're diagnosed with pulmonary arterial hypertension, one of the things that they tell you is that you cannot get pregnant because it's too high risk. And so thankfully, I wasn't diagnosed until after I had the boys. But the season of life that we are in with 8-year-old twin boys is sports and school and being in the car 95% of the time, going from one place to another. And I don't think I realized how hard the season was in general of being a mom of twins at 8. But I think the reality of being a mom of twins at 8 with a chronic illness has been more than I could have ever anticipated. And it has become so inconvenient to be sick when you have kids at this stage of life. Pretty much when the boys are in school, I'm going back and forth to doctor's appointments. I spend a lot of time going to the doctor in general, but then I feel like when the kids started school, I thought that I was going to have all of this time to have a hobby and do all of these things. But really, a very large portion of my life when the kids are in school is me catching up on just the routine doctor's appointments, and then also having to adjust to my schedule and pick up and drop off and sports to the reality of all of these doctor's appointments cannot just happen during school hours. As best as I schedule them, sometimes they happen after school. And so somebody has to be home to take care of the kids in order for me to go to these doctor's appointments, or the inconvenience of having to take them with me if I can't reschedule and somebody can't be home. I have been very lucky that my husband works a schedule where he's usually home by the time the kids are out of school. But that's not always the reality. Sometimes I have to pick the kids up from school because they're sick. And for example, this season of life has also meant having really gross, sick 8-year-olds. And a couple of weeks ago, my kids both had the flu. They woke up in the morning and they both had a fever, and it's not even freaking flu season. And I was hopeful, honestly, that it was strep, because you get on antibiotics for 24 hours, the fever goes away, and then you can go back to school. They actually had the flu, and they were home for 5 days. And so all of my doctor's appointments that week had to be rescheduled because I had 2 sick kids at home. We couldn't go to sports, and they also weren't eating. They're throwing up. It was like a whole thing. And the thing with kids being sick around me is that parents that have kids, you already understand kids being sick is its own kind of chaos. And it's honestly so exhausting. It's so messy, and you're barely sleeping because you're checking on your kids in the middle of the night, and they're coming to you in the middle of the night because their throat hurts or they're throwing up or whatever the case is. But when I have sick kids, my life is so much more difficult that I don't think I realized how big of a deal it was going to be. I have always had kids since I was diagnosed. Like when I was diagnosed, the boys had just turned 1. And I've always had kids when I have been diagnosed, but it's different now that they're in school. They bring home stuff all the time. And this was probably a really intense example, but them having the flu is already a big deal. And I'm supposed to get a flu shot every year because the flu can lead to pneumonia. And because pulmonary arterial hypertension is a pulmonary disease in origin, me getting the flu is a big freaking deal because it can so easily turn to pneumonia that I cannot describe to you the amount of anxiety and paranoia I had around getting sick. Because up until this point, I mean, we have been very fortunate and have not really gotten the flu since they have been in school. But I am almost always paranoid that I'm going to get sick because I always do get sick. Because as a mom, of course, if the kids come home from school and they're sick, then I, without a doubt, will probably also get sick. And that sucks, but that is just the reality of being a mom to kids. Like, all of my friends expect the exact same thing with their kids. If their kids are sick, some of the parents are probably going to get sick, and it just is what it is. But being sick with pulmonary arterial hypertension and then having your kids get the flu is more than just a bad week. I was so constantly calculating in my head how much exposure and risk I was giving myself every time I had to interact with them. I was washing my hands so much that my fingers were so dry and they were like almost bleeding because I could not stop washing my hands. I was so paranoid. I sanitized the entire time. Anytime they talked, I pretty much was sanitizing. And I honestly was just hoping for the best. And then I was preparing for the worst. What happens if I get the flu? If I get the flu and I start coughing, at what point do I start talking to my doctor about the possibility that I am getting extra sick? And like, when do I get checked for pneumonia? That kind of stuff. And I go down this rabbit hole of the worst case scenario. And then nobody sees that part. That's the part of my body that nobody else can see. It's the stuff that's going on in your brain, but it's also the stuff that adds a layer to the already complicatedness of being a parent. And in this season, it's just, I cannot add another layer of stress to this body. And it's honestly something that I constantly am dealing with because that's just the reality of having kids. On top of children and children getting sick, there are other ways that being chronically ill can be so inconvenient. For example, if you haven't been following along, I have a procedure coming up. I had a bunch of abnormal paps, and that has led to a biopsy, and that biopsy came back with high-grade cells. And my local gynecologist suggested that I get a LEEP procedure done, which is pretty much like they shave the top layer of your cervix to get rid of those cells. It's pretty much a preventative and like a treatment for the high-grade cells. But The gynecologist here only does it under general anesthesia because apparently it's really painful. I could not find a single person locally to do this procedure. There was an outpatient center and the local hospital wouldn't take me. And so then I had to be referred to Mayo, which all in itself is super inconvenient because we're talking over the span of 2 or 3 months here. And it's not only that it's 2 or 3 months, it's the inconvenience because I've had to get blood work done for both of those months that got canceled. And so now you're talking about adding medical bills to an already medically stressed family. And then you're also talking that I have been waiting months to have this procedure done. And it honestly is a very routine procedure. It does happen very often. People have this done way more often than I realized. And I cannot have anybody in my freaking county do this procedure because I'm so medically complicated. And then to add to that inconvenience, I've had to be on the phone with insurance because both of these places that they referred me to that eventually canceled, I had to make sure that it was going to be covered. And then I already paid a premium expecting that it was going to be done. And then that got canceled. And then they were like, well, nobody here will do it for you. So you're just going to have to go to Mayo. And so I had to schedule a day randomly that I didn't expect to have to go to Mayo because I had gone to Mayo the week before. I only go every 3 months now, thankfully. And I had not anticipated going again for another 3 months. Well, then this whole procedure thing happened and they were like, we're going to refer you to Mayo. It'll be quicker for you to get in there if your doctor refers you. And, I texted my doctor, he put in the referral. I got scheduled for Mayo Gynecology on some random Monday. And then I have to drive 2.5 hours from where I live to Jacksonville. And it's only because nobody locally would take me. And then for a procedure that most women can get done in a 15-minute drive from their house, I couldn't even get it done anywhere less than an hour away. They also offered to refer me to Orlando, but I wasn't established there. And then that is its own inconvenience of having to get established before you can have a procedure and having to drive out there to get established and then having to drive back out for a consult. And so I drove to Mayo for a consult, 2.5 hours there, had the consult, 30 minutes later, drove 2.5 hours back just to get scheduled for a month from now. It's so much. And it's so many moving parts, and it's something that should be very routine. My gynecologist at Mayo was like, I don't understand why this is such a big issue. They should just be able to do it in clinic. And I was telling him that the local gynecology does not do it in the clinic with localized numbing. They only do it under general anesthesia. And he was like, I'm not going to put your body, who has pulmonary arterial hypertension, I'm not going to put you under anesthesia just to have you under anesthesia. He was like, that itself is high risk. I can just do it in the clinic. I can walk in and walk out, not under general anesthesia. And honestly, I've had twins vaginally and I deal with site changes all the time. My pain tolerance is incredibly high. And so he was like, unless you're like genuinely petrified, and I will put you under general if that's what you want, but I can just do this in the clinic. I do a bajillion of these. I can numb you and then have it done, and then it won't be that big of a deal. And it just sucks that I wasn't offered that here, even though the gynecologist here probably could have done it in the clinic. I understand that he doesn't want to put me through pain and wants to put me under general, but if we're running into all of these roadblocks, and you're having to send me out of the freaking county just to get this procedure done, like, why wouldn't you have offered it here if I could deal with the pain? I feel like that's in itself concerning that I wasn't offered it locally. It's so inconvenient to have to drive all the way to Jacksonville for a consultation for a procedure that I've had 2 consults on already, had to drive for another consult just to get scheduled for this procedure that could have been done in office. It is so exhausting to not be able to be seen locally for a procedure. And it's so incredibly annoying to have to drive 2.5 hours anytime I need something done. But on top of all of that, you have to also understand that I have other appointments that are always on my calendar. I have follow-ups, I have labs, I have pulmonology, I have dermatology, I have an allergist, I have a dentist. I had a retina tear. So I have to see retina. There are genuinely so many doctor's appointments that my calendar is absolutely insane. And then you have to add in the fact that I'm traveling for work. I'm speaking all over the country and I cannot just be a patient all the time. I also have to be a mom who has children's games on the calendar. We have practices, we have family things to do. And all of that also has to be taken into account because I have a site that is seemingly going bad right now. And I am leaving for DC in a few days for like a 2 or 3 day conference. And it is so annoying to think that my site is going bad. And I am, no joke, going to be so annoyed if I have to change this site before I get to DC or after I get home from DC, because the next 3 weeks of travel is going to be insane. But I'm like confident that my site is going bad. And so not only do I have to deal with all of this other stuff, but then I have to deal with the pain of Hell Week, the inconvenience of having to change a site and deal with an infection and then having to decide where I'm going to put it, and then also having pain fog while I'm dealing with all of this. And then still on top of that, still having to be a mom and a wife and a patient. And so I just want people who are listening to understand I'm not complaining. I'm trying to give you a whole picture of what the reality looks like in someone's life with chronic illness. I am not the only person that's dealing with this. My husband has to deal with my schedule. He works around everything for my schedule because he's also working a full-time job because somebody has to. And it makes things that are already difficult that much harder because I have all of these other things going on because I refuse to let this disease run my life. So I have my own personal stuff going on top of all of these doctor's appointments and site changes and medication changes and pharmacy phone calls. It is so hard because when I was diagnosed, I did not realize what this side of chronic illness was going to look like. And so most things in life, you train for it, like a marathon, you train and it's really hard and you're like having to adjust around your training schedule, but then your marathon happens and then you can just chill after that. That is not what life with a chronic illness looks like. It is constantly going through training and constantly having marathons and never ever ending. And I think that the chronic illness side, the inconveniences don't ever just stop. They don't just resolve after a few weeks. It is that some weeks I'm traveling 5 hours for a procedure that nobody will do locally. Sometimes I have 3 or 4 appointments during the day. I have multiple phone calls all day to pharmacy. I have multiple phone calls to insurance trying to get things covered. And then I still have to do all of the other things that I have responsibilities for outside of the fact that my body is just not working sometimes. Being chronically ill is all the time. It means that you're always adjusting. You're always trying to figure out a way around it. You're always trying to negotiate what you can and can't do that day based off of how you're feeling. And I don't think I knew in 2018 what this was going to look like. And I don't think I knew the gravity of the diagnosis wasn't just the diagnosis, but it was the upheaval of my entire life. I have had to reorganize permanently things around my life because of this diagnosis and because of this illness. There is no opting out here. It just is what it is. So here we are, just adjusting and just figuring it out as we go. And honestly, I'm just doing whatever I can because I have to. There's really no option. There's no opting out. It doesn't just stop because I want it to and because it's inconvenient. And it's just so exhausting sometimes. But I'm so thankful that I do have the health ability to do these things and manage these things. I'm also so thankful that I have a team in Mayo that is competent and can handle my case no matter what. And I'm also thankful that I have health insurance that can see great doctors and that we are financially okay enough that we can handle all of the financial stresses right now. But it's always something in the back of my mind of like, can we pay for this procedure? Can we pay for this medication? Is this going to put us under? Have we met our out of pocket? Those are stressors that never seem to stop. But I'm so thankful that we're in a place where all of that has been taken care of for right now. And I'm going to continue to be thankful for that while I can. I'm thankful for my husband who steps up when I need him to. And he is always willing to do whatever he needs when I need help. I'm thankful for a community who steps up when I don't ask for help because I'm not good at asking for help. And I'm glad that they recognize that and they will step up even if I don't ask for it. I'm thankful for friends who I can vent to and a friend who is a great, not therapist, because there's a lot of mental stuff that comes with being chronically ill. So, yeah, I mean, that's it for today. I mean, I hope that this resonated with you. I hope that if it resonated with you or could apply to your loved one, that you send it to them. And if you're new here, I'm glad you're here. Welcome. This is what life looks like with a chronic illness. And it's not always pretty. And there doesn't always have to be a silver lining. If you're listening to this and silver linings are like your thing, I'm your girl. I'm a silver linings kind of person. I'm always looking for the good part, even when it sucks. And I am not the negative person that will always just get online and complain, but I also want to hold space for all of the hard stuff. So if this is you, I hope that it resonated with you. I hope that you took something away from this, and I will see you guys next time.